Welcome to the UnityPoint Health Meritor OB Services Postoperative Education class. This video is brought to you by UnityPoint Health Meritor, their partners UW Health, and the practices that provide obstetric care at Meritor Hospital. You are watching this video because you had a cesarean birth, which is a surgery. We want you to understand what to expect during recovery. We want you to learn about your care after surgery, including what problems can develop and when to call your provider's office, as well as to answer any questions you may have about your recovery. During this video, you will learn about pain or discomfort you may experience after surgery, how to take care of yourself during recovery, what activities you can or cannot do while recovering, what precautions or safety measures you should take to stay healthy during recovery, and where to call if you have questions or concerns. This education is not meant to replace conversations with your provider. It is meant to provide education or a review of what your care team discussed with you. If you had a planned cesarean, this information will be similar to the video you watched before your surgery. If you had an unplanned cesarean, the following suggestions will assist you with recovery. If you had an unplanned cesarean delivery, you may have more questions. We suggest that you talk with your OB provider about the labor and delivery. This can help you understand why a cesarean was needed. This is also an opportunity for you to explain how you're feeling about the cesarean delivery. It can be hard to know how you will feel after surgery because each person is different. Here are some basics about what you can expect. You will have some pain. This is normal after surgery. Your care team will manage the pain and make sure it is not excessive or dangerous. You will be tired for many reasons, like the lack of sleep during late pregnancy or the anticipation of surgery, from the surgery or medications used during the surgery, or from the baby waking you at night. You may feel weak, which is normal after surgery. You will still have some numbness from the medication. For that reason, it is important that you have help the first few times you get out of bed. You may feel an urge to go to the bathroom, but having a bowel movement may be difficult for several reasons after delivery. Some of the medications used can make your digestion sluggish, cause constipation, or slow your stomach. If that's the case, there are some treatments that can help. You may also be slightly dehydrated. We will encourage you to drink water as soon as you are able. You will have vaginal bleeding. Vaginal bleeding is a part of the birthing experience whether you have a vaginal birth or a cesarean delivery. If you feel that you are bleeding a lot, let your nurse know. You may feel queasy or have low or no appetite. This is common after surgery, but if it continues, talk to your care team about it. Our goal is to help you feel the best you can after surgery. If you feel uncomfortable for any reason, let your care team know. The Foley catheter or tube in your bladder will stay in for a few hours after the surgery. Your nurse will remove the tube about 4 hours after you get to your postpartum room. That is the room you will stay in after baby is born. Your nurse will help you get up and out of bed to go to the bathroom or sit in a chair after your Foley catheter has been removed. Remember, there can still be some slight numbness, so you should not try and get up on your own for several hours. If you feel you are ready to get up, call the nurse to help. We want to help you get up and move around as soon as you feel ready. There are many ways to manage your pain after delivery. After delivery, you may experience lower backache, sometimes caused by the uterus contracting after delivery, uterine cramping as the uterus returns to its normal size. You may notice the discomfort increases with breastfeeding. That's because breastfeeding promotes the healing process by encouraging uterine contractions. Pain from the incision. There may be tenderness, soreness, or burning. A strong urge to pee due to the catheter in your bladder during and just after surgery. You may also experience bladder spasms for the same reason. Please let us know how you're feeling so we can help. We can provide over-the-counter pain medications. These are the safest and have the fewest side effects. We schedule these medications around the clock to reduce your pain, acetaminophen and ibuprofen every 6 hours. This works well for many patients. Every patient is different. Some will experience more pain than others. We consider how each patient feels. Some patients may experience severe pain that may need additional treatments. For those patients, we may provide IV pain medication or pain pills prescribed by their doctor. These are typically opioid or narcotic pain medications. These types of medications can slow your recovery. On the next slide, you will see an example of a typical pain medication schedule. As you can see on this slide, we would typically continue around the clock with acetaminophen and ibuprofen on 6-hour intervals, but can include a narcotic or opioid pain medication if needed to assist with pain. We use narcotic or opioid medications as a last resort. There are several other ways to make you feel more comfortable after surgery. Heating pads, warm packs, or ice packs can help ease discomfort. If you choose to use a heating pad at home, please make sure there is something between you and the heating pad. Don't fall asleep with the heating pad on or under you. Make sure you check the heat setting to avoid burns. Ice packs can also burn the skin if they are too cold or left on for too long. Limit the time you use heating and cooling packs to about 15 to 20 minutes for safety reasons. Do activities that take your mind off the discomfort and increase emotional well-being. Some examples are holding your baby, feeding your baby, short walks, spending time with your support person, or doing something you enjoy like reading, watching a show, or playing a game. Make sure you take time to rest in between. As you get back to your normal activities, pay close attention to how your body feels. Your body will let you know if you are doing too much too quickly. Movement helps the body recover and improves muscle tone and digestion. Slow down if you have increased pain or bleeding with activity, or if you're feeling exhausted, especially if you feel you cannot care for yourself or your baby. Always contact your care provider in the days and weeks after surgery if you feel something is not right. Remember, go slow, but get up and go. Patients often ask, what can I eat and drink after surgery? We will encourage you to suck on ice chips or drink water within 60 minutes of arriving in the recovery area. After arriving to your postpartum room, we encourage you to eat your regular diet. Your nurses will help you order food. We also encourage you to chew gum soon after the operation is complete. Plan to chew gum several times a day, about 3 to 6 times daily, for between 15 and 60 minutes. This can help activate your digestive system after an abdominal surgery like a cesarean. Plan to bring a few packs of gum that you like. After surgery, it is very important that you get up and get moving. Being mobile in the hours and days after your surgery can help activate your digestion, increase muscle tone, improve bowel function, prevent blood clots, and prevent pneumonia, which is fluid buildup in the lungs. You can walk up to 3 miles on a flat surface every day, but listen to what your body is telling you. If 3 miles feels like too much, or you notice the warning signs mentioned previously, limit movement to what feels right for you. Remember, go slow, but get up and go. Some people ask, is my activity restricted after surgery? The short answer is yes. You will have some restrictions. These restrictions are in place to prevent you from re-injuring your body by causing stress to the uterus, the uterine muscles, abdominal core, and organs until you've healed. We do not want you to be operating machinery or driving a vehicle while on narcotic or opioid medication. This is very dangerous. Other limitations include no lifting, pushing, or pulling more than 10 pounds or about a gallon of milk for the first 6 weeks or until your provider says you can. No engaging your core. Your core consists of the muscles and structures supporting the central part of your body, diaphragm, and pelvis. If you have exercises you feel you must do after surgery, please make sure these are approved by your provider. Otherwise, don't do it. Everyone can use the stairs unless you have a specific condition that prevents you from doing so. Just take it easy. For the first couple weeks after surgery, you should not drive. Here are some quick guidelines. Do not drive while on any narcotic or opioid medications. These can make you less alert or sleepy, making driving dangerous. And do not drive if pressing on the brakes is uncomfortable. This is dangerous and may slow the healing process. You can return to driving when you are no longer taking any narcotic or opioid pain medication, and you can use the brakes safely without discomfort. This usually happens 1 to 2 weeks after surgery. Note, if you're not sure what qualifies as a narcotic or opioid, ask your doctor. Caring for your incision is an important part of keeping you healthy after surgery. Follow your care team's instructions. In the next couple slides, we will cover the basics about incision care. While in the hospital, you will have a bandage over your incision to protect the area. The bandage will be removed about 48 hours after your surgery. The bandage will only be removed sooner if there are concerns such as bleeding. Please let your nurse know if you see bleeding from your incision or if the bandage falls off. Do not remove the bandage on your own. You may have steri-strips or incision-safe glue to help close your incision. If you have steri-strips or small bandages that go across the incision, leave them on until they fall off. Do not pick at them or peel them off. If you have incision-safe glue, it will just flake off on its own. Do not pick at the glue. We will give you sanitizing soap to clean your incision. You can shower and let the soapy water wash over the incision area, but do not scrub the incision site. When you dry off, only pat the area dry or use a hairdryer on the cool setting to dry your incision. In some cases, special incision care is needed. If you need this, your care team will go over instructions with you on how to care for your incision properly. Interdry is a special fabric that helps to keep the skin dry in certain areas. It helps to wick or move moisture away from your incision during healing to help prevent infection, bacterial growth, and inflammation or swelling. Another special treatment is a wound vac. A wound vac helps promote healing. If a wound vac becomes part of your recovery plan, it will remain in place until discharge or about 1 week after your surgery. Your provider will discuss your exact instructions with you. In the next slides, we will talk about the recovery process and what to do if you notice something concerning. To begin, let's talk about diet. You can eat a regular diet as tolerated. Avoid any foods that could cause problems, for example, greasy, spicy, or fatty foods. Though they may sound appetizing, they can cause stomach upset like nausea, vomiting, or bloating. It is also very important to drink plenty of fluids, especially water. This helps aid your recovery. No matter what type of birth you have, it is important to rest your pelvis afterward. This means nothing in the vagina for at least 6 weeks, which means no sexual intercourse, no douching. A douche is a bulb with an insertion device you place inside the vagina to cleanse internally and is generally not recommended. No tampon use. Once you're completely healed, you should be able to resume the use of tampons, but waiting at least 6 weeks or until your postpartum check is important. No other items inserted into the vagina or the vaginal opening. And no soaking, sitting in baths, hot tubs, pools, or open water like lakes or oceans. Remember, once you have your healthcare provider's approval, you can resume most activities safely. Vaginal bleeding is a normal part of the healing process after delivery. You will have vaginal bleeding and past clots. If you have the following symptoms, you should contact your doctor. Vaginal bleeding that is soaking one large postpartum or heavy flow pad in an hour for 2 or more hours straight. You have vaginal discharge that has a foul odor. Postpartum bleeding and discharge have a blood-type smell, but if your discharge smells bad, you should contact your doctor. Constipation is difficulty having a bowel movement or going poop and can be common after delivery. Having constipation can be painful after cesarean deliveries. The opioid medications used during surgery for pain control can worsen constipation. This is the reason we try other medications first to help manage pain. There are certain medications you can find at your local pharmacy or retailer that can soften your stools and stimulate your digestive system. Colace, senadocosate, and Miralax are all commonly used. Remember that eating a high-fiber diet and drinking lots of fluids can also help, so keep drinking water. Depending on your health history, your doctor may recommend blood thinners after delivery. This would be based on your risk factors, and your provider will discuss this with you. Patients ask, when will I go home? If you're meeting your surgical milestones, we want you to be able to go home and recover in comfort. Most patients meet their surgical milestones and go home 2 to 4 days after their cesarean surgery. If for some reason you are not meeting your surgical milestones, we will not send you home. In rare cases, due to complications, patients may stay longer. If after your discharge your baby needs to be in the NICU, you can stay in your baby's room. We know it is safe for you to go home by looking at certain surgical milestones or indicators that tell us you are healing well. These surgical milestones include that your pain responds to oral medication or pills, you can walk or are resuming normal mobility, you can urinate, you can tolerate eating and drinking, you are passing gas, and your bleeding is controlled. When you can return to work is different for each person in each work situation. You may have already worked out a basic timeline with your employer. You should ask your provider when it is okay to go back to work. Your nurse can help you with any paperwork you need. After discharge, you should call the doctor if you have a fever greater than 100.4 degrees Fahrenheit or 38 degrees Celsius, Your pain is not helped with the pain medication you are taking. You have heavy vaginal bleeding. That means filling a postpartum or heavy flow pad in 1 hour for 2 or more hours in a row. You cannot tolerate eating or cannot keep food down due to vomiting. There is redness or drainage coming from or around your incision site, and/or you have abnormal or foul-smelling discharge from the vagina. You should call anytime you feel something isn't right. We are here for you. You may need to contact help after going home. My chart is great for non-urgent questions. If you need a faster response, we recommend calling your obstetric provider's office. For after-hours assistance, call Meriter Hospital at 608-417-6000 and ask for the OB/GYN resident. You can also contact your OB provider's office and ask to be connected to the provider on call. Always follow your care provider's instructions. Instructions can also be found on your AVS or after visit summary. For emergencies, go to urgent care or the emergency room, or if needed, call 911. By the end of this video, we hope you can say, I understand that after surgery, I will have pain. I understand that my pain will be mostly controlled with scheduled pain medications. I understand that opioid or narcotic pain medications can have side effects. I understand I can use other pain management methods to help me feel better. I understand I need to rest my pelvis for at least 6 weeks after surgery. I understand how to contact help if needed. I understand that my provider and care team will support me after surgery and through my recovery. This video was created by physicians, nurses, administrators, educators, patient representatives, translators, and other health professionals who, as members of the organizations listed below, provide care at UnityPoint Health Meriter Hospital. This educational video was made possible by a research and educational grant from the UnityPoint Health Meriter Foundation.